Hi, good evening, everyone. I think I'll start the sharing now. My name is Angela Yo Yoon, and today I would just like to share with you on the miracle of integrative medicine. There's hope for everyone who has any health issue. And I'm really very passionate about this medical laser, this medical device. And can you hear me? Because I'm not sure if you can hear me. Can, huh? Okay. Can. Okay, I'll just proceed on, sorry, because I can't hear myself. I am actually right now 63 years young, and I'm married with 4 children. Sometime I'll just share with you the story of my story in my journey using this medical device. Some time ago, in the year 2013, in December, I actually discovered that I had cancer, and prognosis for me was not good at that time. And there were 3 surgeons operating on me. I had a vascular surgeon, a gynecologist, and a colorectal surgeon. It was a 9-hour operation. And at that time, I wasn't even sure whether I would be alive today. And I really truly praise and thank God for giving me a second chance to having good health again. Right now, you know, I'm as healthy as ever. I've not seen doctors complaining about, you know, getting cold or fever or anything for many years. After my operation, actually, they discovered that I actually, as I say, my prognosis was not really good, and 12 inches of my colon went off, and I also had my ovaries and my womb taken out. And the vascular surgeon also removed 24 lymph nodes that was attached to the main artery that leads to the heart, and of which 21 was infected with cancer. So as they were sliding off the lymph nodes that was infected with cancer, actually the artery also, they accidentally punctured the artery because the cancer, you know, lymph nodes was all clunked. They had their roots all over the artery. So it was a very delicate operation. After the operation, when I recovered from the operation, I then went to seek various oncologists to see what treatment I should do. And so what I did was I chose finally, I actually did chemotherapy and radiotherapy. Chemotherapy was actually, I would go into the hospital. I went for 6 cycles. The first day would be intravenous with 3 different chemo drugs into my body. And for the next 14 days, I would take oral chemotherapy 3 times a day for the next 2 weeks. Taking chemo drugs is not, it's really, you know, your body, it kills everything, the good and the bad cells in your body. So you do not really feel very well at that time. And as I say, I'm really thankful to be alive today because I discovered this amazing medical device that has really helped me to come back to good health again. Many people, when medical science say that I would not be able to live that long, but I'm still alive today. And so after my chemotherapy, I had radiotherapy. And, you know, when you do radiotherapy, it really, they were shining, the radiotherapy was on my lower part of my body. So everything down there is dried up. And I could not control my bowels. I would go to the toilet maybe about 15 times to 30 times a day. And it's a very awkward feeling. And the chemotherapy also, you know, destroyed the nerve in my body. So my hands are numb, and my feet, when I walk on the floor, I cannot feel the floor at all, because the nerve is all dead. So after actually my chemotherapy and radiotherapy, after some time, a friend of mine, Christy, actually, she came back from Singapore, and she was just, you know, very excited and told me, hey, Angela, why don't you look into the low-level cold laser therapy? It might help you. I was not sure at that time because it's relatively unknown. And I actually went to the office, and there I met one of the directors there. He didn't know anything about me, but when he did the Neophil capillary test on me, he couldn't see any what do you call that, vessels. You know, you can't see any capillaries at all. It's all shrunk and dried up. And so he asked me, are you on chemo drugs? I said, yeah, I had chemotherapy. At the time when I went to the office, I did the photobiomodulation therapy, and I really, you know, it just put me into sleep. I couldn't even, you know, listen to him properly because half of the time I was in sleep. I was sleeping, and so I went back and I did a lot of research. I went to you know, ask doctors, specialists. Most of the doctors do not know anything about the low-level cold laser therapy. I finally went back to the office again, and this time I actually met the CEO of the company, and he was there leading me through, you know, the scientific why it is good for the body to heal itself, this photobiomodulation therapy. After listening to Mr. KG Lim, I asked him, what shall I do? He said, Angela, just use it. And because this therapy is a non-invasive therapy, it's only a spectrum of the sunlight. When God created the world, he created sun, and then the sunlight gives life. And this is actually a small spectrum of the sunlight that helps the body to heal itself. So when I actually decided to use this amazing medical device, after 3 weeks, I just told my husband, Simon, I can now feel the floor. I was so happy. And the nerves were all growing back, and I can feel again, you know, the floor. I can feel the ground. So this is just light, a small spectrum of light, which is only 650 nanometers, and it does wonders to the body. So I would like to, you know, when doctors told me that the prognosis for me was very, very bad, as I say, I should not be alive today. But I truly thank God for the grace of new life. He has brought so many people into my lives to show me, you know, there is hope. And in this medical device, it has brought me actually back to new life again. So I would just like to explain to you what is this integrative medicine co-laser technology. What is it all about? In fact, it has been used for many, many years now. 30 years ago, it was actually, they were using it in the West. They were using they were very popular in doing, how to say, pain therapy to reduce pain in the body. So the low-level laser therapy, actually, it is a non-invasive treatment where when you use the therapy, it actually hits at your cell and trigger the mitochondria to produce ATP, which is the adenosine triphosphate. This is actually the cell energy in the body for your cells. And if our ATP is low, that's where all the sickness comes in. And also the reactive oxygen species, it would trigger our mitochondria to produce more reactive oxygens, the nitric oxide in the body. The nitric oxide is very, very important for our health. As right now, I'm 60 plus years old, and the nitric oxide production in my body is just 30%. So as we age, the nitric oxide production in the body goes down, and that's where heart disease comes in, heart ailments comes in, because our arteries is already clogged up with what do you call that, with plaques, you know, because so nitric oxide actually helps the arteries to be soft and stable, and it helps in the cardiovascular system, the respiratory tract. So, you know, when during COVID time, when people has COVID, actually nitric oxide would help to protect the lungs. So for Simon and myself, and because of our frequent use in the photobiomodulation therapy, and our body is full of nitric oxide, we had not contacted the virus. We have not contacted the virus. So it also helps actually in immunology. It gives you, nitric oxide gives you better immunity, and it helps in the nervous system, the central nervous system too. And for those with gastrointestinal ailments, it really helps with it. And also in sexual health, where men, when they have erectile dysfunction, nitric oxide actually helps them to come out of ED. You know, Viagra, when you hear of Viagra is actually nitric oxide. So nitric oxide helps the body in our body in all aspects of the body. And I'll just go back to, why is ATP, adenosine triphosphate, why is it important? ATP actually, it helps in cell repair in our body, because as we age or as we grow, we need cell repair. So it helps in cell repair, cell regeneration, and cell bioavailability. So when you have a lot of nitric oxide, if you eat anything in a body, it gets absorbed, you know, in your body system. So this ATP is very important to maintain the total cell balance of our body. It also actually helps to produce the reactive oxygen species, where these ROLs helps to take away the free radicals out of our body. So when you do the photobiomodulation therapy, you're actually doing blood chelation. So whatever toxin that is in our body system, from our liver to our kidneys and all, it helps actually to take away all the toxins in our body, all that is not healthy in our body, it will be taken out. So that's why we say when we do this therapy, we really encourage you to drink a lot of water before and after the therapy, so that any toxin in the body can be taken out from the body through this therapy. I would also like to share on, some people say that why, I'm using this integrative medical laser and I've not found any progress in my health. I would ask you, how often do you use this therapy? Because what I would encourage you is to use it for maintenance wise at least 3 times a day. If you are going on a healing medicine, do it at least 4 times a day. The moment you wake up in the morning, just after lunch, before dinner, and then just as you're going to bed. So at least 4 times a day if you want your body to heal itself, because this photobiomodulation therapy would help your body, the organs, to heal itself. So when you do the therapy, the main therapy is actually putting the nasal line in our nose. Why do we do this? It's because the nose here, there is actually a lot of capillaries that goes up to the brain. And our brain is actually the computer for our whole body system. So as it stimulates the light will stimulate the ATP in our the cells in our body to produce ATP. And what it does too is it also helps to produce a lot of oxygen that goes to our brain. So that's why it's very important, because if we do not have enough oxygen in our brain will start shrinking as we grow old. And that's where, many people, they would suffer from forgetfulness, dementia would step in, all the anything to do with the brain, neurological dysfunction would come in. So this is actually a very good therapy to stimulate the brain, to give the brain a lot of oxygen, and also the brain would instruct the body where it needs, it to produce stem cell to heal the organs. So this is a very, very important therapy. Do not miss out on doing the nasal therapy. So this medical device, it actually has 3 components. One is it does photobiomodulation therapy. It also do acupuncture to the 361 points in the body. So it is actually non-invasive acupuncture, and it's actually more accurate than the actual acupuncture that you do, the physical acupuncture. So as it goes in, as the laser therapy, the light goes through your body, it actually opens up the 361 meridian points in the body. And so this would actually encourage better blood flow. And if anyone have any stiffness in the body, it would help to release that stiffness in the body. And also we have the magnetic therapy, where it helps in the treatment and enhancing the blood flow. So this is actually very good. For me, I use this most of the time when I go out. When I go out marketing or, you know, into shopping complexes, I always put it on. So I always put it on so that I would want my body to produce enough nitric oxide to prevent me from getting or get infected with COVID. So this is actually a preventive measure when you go out. And also, you know, if you're going on a long distance drive, men use this, or drivers use this. And for those who would like to reduce your weight, let's say after food, put this on, because this would encourage the blood to flow, and also to increase your body metabolism, so that it will burn more energy in your body, and you can burn your fats too in the body. So this is a good way actually for those who are overweight. You can actually use this after meal. And for my husband, Simon, he was actually 110 kilos before. And he lost weight gradually, and today he is only 85 kilos. 84, 85, 86 kilos, it varies. And his waistline was 40 inches before, and today is 36 inches. So he has lost 4 inches, you know, of waistline. So for ladies, for those who want to lose weight, this is a good option. Very, very good option. There's some question that has been posed to me, and I'll just answer this. And after that, we can also have question and answer. Yeah. Any questions you can ask. Yeah, Christy, can you go to integrative medicine? Yeah, okay. This medical device, it is actually called, we call it integrative medicine, because there is actually no chemical in it. And what it does is it actually treats our symptom. If you have got arthritis, it will treat the pain. It will bring down the inflammation when we have arthritis. And it also addresses the root cause of the illness. Why do we get arthritis? It also addresses that, the root cause of it. And when you use this therapy, it will produce actually long-lasting results. It's not like headache, you know, when each time you get headache, you pop in a Panadol. No. And for me, ever since using this medical device, I've not taken Panadol or any painkillers for many, many years. And this actually addresses chronic problems too. Any chronic problems that is in your body, the body will know how to heal itself in its own time. Sometimes it is very fast. Sometimes it takes a few months. So integrative medicine actually treats the whole person, not just the disease, but the whole person. Okay, I would just touch on, there's some questions that are being posted to me on can autoimmune person use this medical device? Yes, definitely. Those who have any autoimmune disease, you can use it. I'd just like to share my goddaughter at the age of 17, she had myasthenia gravis. It is a chronic autoimmune disorder. What happened to her is Felicia, her name is Felicia, her whole body freeze out. She cannot move. She cannot open her mouth. She cannot, she is like a mannequin, like a doll. So her parents would need to turn her, if she's on the bed, her parents would need to turn her. She cannot do anything. She can't walk. She's just bedridden on the bed. So Felicia, actually, the parents, actually her treatment, they actually went for experimental treatment because this is actually a very rare chronic autoimmune disorder. And I think, they spent more than $1 million trying to heal her, but still, she is on a wheelchair. She cannot walk. And so when I knew about it, we actually got her to use this medical device. And within 3 weeks, she was up and walking. Where before, when the parents needs to bring her to the hospital, they had to either call an ambulance to bring her because she's immobile. So when, in fact, doctors were amazed by her healing. Her parents actually spent even, they need to sell a house even, to help to seek alternative treatment for her, but nothing helped her. And this device that cost so little solved all the problem. So today Felicia is able to, she's able to travel. She's actually back to normal again. Yeah. So for those with autoimmune disorder, the photobiomodulation therapy would really help the body to heal itself. So another question is, can I use traditional medicine combined with iron laser? I would say definitely yes, because the iron laser, normally we would, in many illnesses, we would use it as an adjunct therapy together with another therapy, like eating proper, taking a proper diet, eating proper food. So you can use it as an adjunct therapy. There's another question that ovarian cyst, endometrisis, will it help? Yes, we have got instances when people had this problem, and actually because it brings down inflammation, it actually, the cyst actually grows smaller and smaller. Yeah, and sometimes may even disappear depending on how big it is. Yeah, and recently, actually, I have just a sharing. This person actually has a lump in the breast, and she started actually using this photobiomodulation therapy together with also eating right. And by the time she went for her operation, when they did the biopsy on her earlier, it was actually a cancerous lump in the body. But when she did the lumpectomy, the lump actually turned into calcified calcium. So it just disappeared. You know, the cancer just disappeared. The cancer, you know, just disappeared. So, so as I say, there is hope for those who have cancer. I'm not saying that I just share on cancer, because I am a cancer survivor, and I'm so passionate about this medical device because it has helped me, and it has also helped a lot others who have gone on this therapy. Last year, we actually had someone who had 4-stage cancer, and of course, he used this therapy together with eating right and going on eating, you know, eating right, taking the right vitamins in. And actually from 4-stage cancer, the cancer, he went down to 0-stage cancer within 1.5 months. Yeah. So it is possible, as I say, where there's no hope, this medical device would give hope. There's another, I would like to share another story too about this lady who had 4-stage cancer, and she was already at her last leg of her life, and doctors have given them very short, you know, period of time, and her children all came back. Her husband loved her very much, and so I do not know how he got to know about my sharing. So he actually contacted me and asked me, you know, to see if there's hope for the wife. When I met her at that time, she was already on morphine. The cancer has gone into her brains, into her bones, all over her body, and she was truly in pain. At that time, actually, when I saw her, she wanted to really so much to live. She had so much will. And I just told the husband, why don't we just try this on her? And her body was really so cold. And so, you know, it is just teaching her the right way to eat, because she could hardly eat. But to keep her body warm, we, you know, we just use ginger, to let her drink ginger water to keep her body warm, and to give her nutrients into the body too. Until I met her actually in January this year. Today, she's still alive. The last time I met her, which was a few months ago, she was actually seated up at on her bed, playing with the computer. So, you know, from a person who was already losing her life here on earth, she has, right now, she has got the energy to live well and quite normal in that sense. So this has given her hope. Yeah. So at least she's not in pain, and she's able to enjoy her life, her everyday life. Okay, can a person with a pacemaker use this medical device? This is actually only a small spectrum of the sunlight. I'm not a medical doctor, but I have seen people who have a pacemaker using it. So I think it's okay. If the person who is using the pacemaker dare to go out in the sun, you know, to be under the sun, then using this medical device is okay. because it's only a small spectrum of the sunlight. There's no current going into the body. It's only light. If you dare to sit under fluorescent light or even LED light in your house, this is as safe as that. Okay. Okay. I actually in Kuching, when I went down to Kuching recently, I met a friend, a very old friend of mine. Her mother actually has hole in the heart, and she has been going to see doctors because of her heart condition. She's been using this medical device for, I think, about 3 years now. And the good news is when I went there, they told me that doctors are surprised that her hole in the heart, the hole is no longer there, and her heart is normal now. She doesn't need to take, heart medications and anymore. So, and she's already so old. So can you imagine, it can even close the hole in the heart. Our body is actually a very intelligent body. If we put it in the right environment, our body can heal itself. Okay, there's also questions on stents. A person has stents, stroke, heart prolapse, whether they can use the DR Imlaser. For those who have stents, definitely this is a very good medical device to use, because stents, for those who had stent in their, in their capillary, in their, for those who had stent normally do not last a long time, and they need to take blood, what do you call this? They need to take medication to make their blood fluid. So when you do this therapy, it actually helps with the circulation, blood circulation, and it takes away the plaque in the body. Where plaque is starting to form in the stents, it will actually take away the plaques. So it is actually, instead of taking medication, this is actually a very natural means to keep the artery in good condition. For stroke, definitely yes. I've seen stroke patients, they were paralyzed, and now they are walking, they are back to normal. And my mom is actually a success story. My mom is actually a dementia patient. She has dementia for many years, more than 20 years now, but her dementia has not deteriorated. It is stable. And when she had stroke, the specialist told us that she will not be able to walk because her brain has shrunk, and that, for those with dementia, normally they have stroke, they will not be able to walk again. But my mom proved them wrong. While she was in the hospital, we used this on her, and she actually climbed out of her bed one day. Because when she called the nurses, they were late to come. She climbed out of the bed and she's able to walk. For stroke, this is actually good for those. In my journey in this Vantros Healing Ministry, I've actually helped 2 persons to come out of coma when they had stroke. One of it is actually a friend of mine. The mother was in Terengganu and she had a bleeding stroke, and she went into coma. So my friend actually knew about me using this medical device. So she actually, told me to help her to see how can we bring the mother back to KL again. So I actually flew down to Kuala Terengganu and I brought 2 of these medical devices. Her mother was actually brought to the private hospital, but they didn't want to take her because she was life-threatening in that sense. You know, her condition was life-threatening, and sent her to the general hospital. At the general hospital, the ICUs were all full, and she was put in a normal ward in coma with the oxygen mask on it. So when I arrived there, I actually used this immediately on her. One is to put it at her forehead here, and another device is at the navel, and we did the therapy over, I think, more than 6 to 8 times over. So it's about almost 24 hours she woke up. At that time, you know, we actually ordered the ambulance from Johor Bahru. In Kuala Terengganu, there's no ambulance, there's no trauma doctor. So we actually got this ambulance in where they do international repatriation to bring my friend's mother back to KL. And she just woke up actually almost at the same time when the ambulance arrived from Johor Bahru. The specialist there told us that she would not survive the journey because her condition was actually life-threatening. I flew back from Kuala Terengganu to KL, and the next day when I went to see her at the hospital, she was already seated up in the ICU, seated up. She was smiling at me and putting up her hand, you know, to wave at me. So when the specialist was saying that, you know, her situation is already life-threatening,
Angela, we cannot hear you. Angela, we cannot hear you.
over visiting hours, 2 days after using this medical device. And today, this person is able to walk slowly. He is, you know, he's not bedridden. So he uses this actually very regularly. So as I say, you know, this is truly a doctor, a specialist, our very own personal specialist that would help our body to heal itself. Okay, there's also another question. A person with asthma, can it help? Yes, definitely. Because when we have asthma, we need a lot of ATP to help heal our asthma. The adenosine triphosphate would help actually the lungs to be to come to a better condition. So those with asthma, please get this medical device because it would save your life. And in our, when you see, if you have this medical device and if you see a person that just collapsed suddenly, please immediately put this on 4 bars and put it on them, just on the wrist, use it. And we actually had 2 instances. One is a lady in Taman Tun. While she was having breakfast, she just collapsed. And then a friend of ours happened to have this medical device with her, and she went to the husband and said whether she can use it on the wife. And then they called the ambulance. Before the ambulance arrived, she was already awake and she didn't even feel anything. She was back to normal. Another instance was a gentleman who was in Lake Club. He was just walking in and he collapsed he had a heart attack. And someone at Lake Club happened to have this medical device and used it immediately on him. And before the ambulance arrived, he was already awake and, you know, back to normal. So this is a life-saving device. For those with vertigo, can it help? Yes. My husband used to have vertigo, and he would be on medication and rest in bed for 3 days. It doesn't even help him. And at one time, you know, he just collapsed in the office and they thought he had a heart attack, brought him to the hospital, and it's vertigo. And ever since using this medical device, he has never had an attack. Trigger fingers, can it help? Yes, definitely. It would help because it would help in the nerve connection and the blood flow. So, and to bring the inflammation down. So for those who trigger finger, it would really help. Yeah. Tinnitus, ringing in the ears. Yes, definitely it would help. We have got many testimonies for those, you know, they put in the ear and the ringing just goes off. The ringing in the ears just goes off. And for those of us who are having difficulty hearing, you know, our hearing is no longer sensitive, putting the iron laser, you just do a therapy. Just put this 4 bars, put it into your ear, 40 minutes, 20 minutes each side of the ear. And it actually helps to bring it somehow, you know, it heals the eardrum, the whole ear system, and your hearing will be better. Yeah. There is actually an instance in Jakarta when this boy, actually he was born deaf. He cannot hear at all. And so actually at that time, they were just doing an experiment, say, just let's use it on this boy, you know. And so they put the nasal line into his ear. And after doing the therapy for 40 minutes, and they dropped a metal plate behind him, he was able to turn to look where the metal, you know, there was a sound, he could hear the sound, so he could turn back. So it actually helps with hearing. Like my mother, she is 90 years old, her hearing is perfect. She can be in the next room and we are talking here and she can join our conversation. So her hearing, because she uses this so often, her hearing is so sharp. So for those of us who is hard on hearing, try this therapy. It would definitely help. There is also this condition of, if you see, you know, depigmentation of the skin. Do you know of any friends, depigmentation of the skin? If you use it over time, the color, the skin, the pigments will come back again. So we have instances, and medical science, they cannot do it. But with this therapy, the body can heal itself. And the pigments, the skin pigment that has gone, you know, white, no more color, will come back. Yeah. Can I have the PSR? Oh, something that I want to show you. Really have actually getting, you know, forgetfulness. Do this. I have this hairband and the ring is there and I put it in. do this therapy every day if you can. Can you see? Yeah. So do this therapy every day. For those of us, yeah, just here. So it would actually shine into our, they call, the Indians who call it the chakra. For the Chinese, I think that is this meridian point here. And it actually, scientifically, it actually points into our pineal gland. And this would actually stimulate the glands. This is actually good for our brain health. Huh? And for those who have got eye stroke, anything to do with the eye, this is very good. And for me, for those who have gone into coma, I use this on them too, and also on their navel too. I would like to also share, okay, sorry, I'm doing this spontaneously. As I remember, I would share. I met this gentleman in June this year. A friend of his actually told him to call me. When I met him, I brought him to the Vantros office. At that time, actually, he could not walk well. He was actually he couldn't walk well, and he couldn't even climb the stairs. So we had to go up the lift. 2 weeks ago, about 2.5 weeks ago, he actually called me and invited me to his house. And then there I noticed when he came to receive me, he was already climbing up the stairs as normal. He was walking almost normally. He wasn't shaking anymore because he actually had Parkinson. He had Parkinson's. His hand wasn't shaking anymore. And the wife actually told me now he is already driving. Before he could not drive, and if he needs to go anywhere, the friends will come and pick him up, to go out because he could not drive. But today he is driving, and it's only 3 months. I counted; it's only 3 months, and his healing is so good. From not being able to drive, he's able to drive. And Parkinson's, and he told me, he said, Parkinson's is electrical. He said it is not chemical based. So the doctors gave him a lot of medicine. He doesn't take it anymore. He didn't take it because he doesn't believe in medication. And when they will add in more and more medication. And he says, he's no longer on medication, and this medical device has helped him tremendously. So sometimes we do not know the chemicals that we take in our body, what it does, it always has a side effects. But this is actually natural. I would recommend, I'm not sure how many of you are using this. This is actually PSR. You can get this from Vantros. It is actually colloidal minerals. And what it does is it actually helps with when you do the photobiomodulation therapy together with these. If you drink them in water, you drop it in the water, it will help in the nerve connectivity. So this is actually very good. So for those who are going on a healing mode, use this. Yeah. So that's the PSR, the iron laser and the PSR. I equate it with health restoration. So it goes together. So this is nothing chemical. It's just natural base. Natural base. What do you call? It's made from natural, like apple stem cells and all this, so it helps. There's no artificial chemical.